Hi, my name is Alyssa Sayeda, and today I'll be talking about ageism in healthcare. So, I'll be explaining what ageism is, the prevalence of it, how ageism can lead to negative health outcomes, how it can affect healthcare shortages, how it affects older workers, and then I'll propose some fixes for ageism as well as some leadership strategies that can help to decrease ageism. So, what is ageism? Ageism is the prejudice, stereotypes, and discrimination against someone because of their age. Ageism can target a younger population, but it can also target an older population, and I'll mostly be talking about the older. So, some examples of ageism in healthcare include a hiring bias, which is when they only hire people that are under a certain age limit, or elder speak, which is when they talk down to someone that is older, maybe talk to them like they're a child. Assuming that someone is frail or assuming that someone is incompetent, maybe talking to their family members instead of looking actually at them. Maybe dismissing their symptoms when they tell you that you'll hear, oh, that's just something that comes with age, which is not always the case. And many of these examples threaten the physical well-being of the patients that are hearing this, as well as the older healthcare workers. So what is the prevalence of ageism? The World Health Organization revealed that every second person in the world holds at least some kind of ageist beliefs. 47% of students in medicine and nursing have witnessed ageism in their workplace. A study also showed that during a lot of clinical trials, 29% had an upper age limit without explaining why. 92% of these trials didn't explain why there was that limit, and this means that a lot of older populations are not being represented in these health trials. Med students, while they're being trained, are actually less likely to be exposed to outpatient geriatrics, which means they're only getting to see the sickest elderly people and not really getting to see more healthy, more active, maybe more physically able older people, which may lead them to believe that that is all old people and have some ageist beliefs. So what is the impact of ageism? A recent review using the data of more than 7 million participants showed that ageism was associated with worsened health outcomes in 95.5% of the studies. So almost always ageism will have negative health outcomes. Healthcare professionals are more likely to withhold life-sustaining treatments from older patients, even if that is what they wanted and if that is possibly better for their ultimate outcome. Older people are also less likely to receive screening for depression. Sometimes they think that being sad is just something that comes with age, when it could be a much bigger issue. Institutional and structural ageism affects health as well. For example, things like transportation, technology, and medication costs can hurt the health of older people. Even subtle ageism, like talking down to someone, being impatient, maybe not looking at them, or ignoring what they're telling you, has been linked to worse results like having lower HRV, avoidance of care, or reduced trust. So this means that after having a negative experience, older people are actually less likely to seek out more care, which is harmful. Also, ageism contributes to a general attitude that older lives might be worth less than younger ones. Especially during COVID, we've seen resources being prioritized towards helping younger patients and not so much older patients. So how does ageism affect older staff? Older nurses are often receive negative responses from their managers when requesting further training or continued learning. Ultimately, older clinical staff were found to have significantly less access to training than younger colleagues. Maybe people think that since they're older, they might not use it as much as someone that's younger. That's not the case. Older nurses often report feeling excluded from discussions about organizational changes and overall feeling that their opinions are less valued, especially versus when they were younger. Some studies have shown that younger nurses hold negative beliefs about the abilities of older nurses, such as thinking that they are too slow or contribute less to the team than the younger people. Some healthcare workplaces are more likely, my camera turned off, I think. Some healthcare workplaces are more likely to advise that someone resigns rather than make an accommodation for the needs of an older worker. A study showed that nursing recruiters considered older nurses to be less capable in terms of adaptability, motivation, training, interest, and ambition. 12% going as far as to say that they would not hire someone over the age of 55. So, ageism can affect healthcare shortages, which is not good because chronic health conditions that require multiple medications, support with activities of daily living, and more access to health facilities are much more common in older adults. Along with an increased aging population, the need for geriatric healthcare is large, but unfortunately we're not seeing that, as gerontology, which is similar to geriatrics but a little bit wider of a scope, is often an undesirable area of practice in relation to other specialties. There's actually 10 times fewer geriatricians than pediatricians, and nurses are often likely to believe that working with older people is indicative of a low status in their profession versus working with other age populations or other specialties. Negative attitudes about aging populations are contributing to an inaccessibility of care for older people. So they have more healthcare needs, but often people don't want to go into that field or think low of that field and are ultimately not getting older people the amount of care that they need to be getting. So what are some strategies to combat ageism? So one method could be to make new policies, make new laws that can prevent discrimination and inequality. So things like requiring age-blind resumes. When someone applies, they won't see what age you are, so they can't take that into account. Reporting on age diversity in a workplace, which will call out ageism if they're only hiring maybe younger people. Provide a tax incentive for equal access training, including older workers, so that they do have better access to training like their younger counterparts. Require workplaces to allow for flexible scheduling and mobility accommodations if the older worker requests it. Mandatory ageism training for healthcare personnel, so they'll be taught about ageism, what not to do, maybe how to recognize it. Require testing to show competency of working with older patients so that they can prove that someone has the ability to be impartial, be equal in their treatment for older patients before they actually do it. Or requiring explanations for age cutoffs in clinical trials so that they can't set those age barriers and make sure that everyone is included in the healthcare trials. Some more strategies are educational strategies to prevent ageism, like teaching about ageism in colleges or in grad school, especially to students that are going to be dealing with that population in health. Intergenerational learning programs, which is when maybe a healthcare worker will interact with an older healthcare worker or interact with just any elderly population where they're mutually learning something from each other. So you get that kind of mutual respect, especially towards the older population. It's not just a one-way street. So adding more classes that teach about geriatric care as well as dispel ageist myths, because a lot of times there is misconceptions about how age can affect your health and gives healthcare workers overall negative opinions of older people that make no sense. Simulation-based learning, especially ones where maybe they put the healthcare worker in the shoes of the older person. They give them weighted jackets, maybe give them some kind of handicap that might make them better understand how older people feel. Bias awareness training/practices, which is training someone to be more aware of their own biases that they have, because sometimes people hold an ageist belief and don't even know that they hold that belief. And then also maybe something like journaling can help someone realize and look back on their interaction with a patient to see if they had any ageist beliefs. So some leadership styles that can help with ageism is having an open style of leadership, becoming a safe space for any employees to just come up to and discuss what they need in their work. Addressing any ageist attitudes within the workforce. Don't allow pluralistic ignorance to spread. This means that you have to set the right standard as a leader to show people in the workplace that ageism is not tolerated. Intentional pairing of staff of different ages. So putting younger staff with older staff and not allowing for that separation, or maybe putting someone that's older in a certain area that they don't want to be in. Providing technology training to all staff, not just older staff, but all staff, so that maybe if an older staff has trouble with technology, they'll be able to access it if needed. Monitoring data like hiring diversity or turnover rates to check for ageism, like if there's not enough diversity in the age, or if maybe older workers are more likely to leave, that means that they're probably not being treated correctly. These are my references. I hope you learned something about ageism and maybe take that into account in your future careers. Thank you for listening.